The transgender movement is using language in a way that is very manipulative. And so I wanted to talk about some of the things that the transgender movement says and what the actual reality is. First one I wanted to talk about is gatekeeping. Transgender activists talk about gatekeeping as a very bad thing. And what gatekeeping is requiring someone with gender dysphoria to get mental health services prior to medically transitioning. And trans activists suggest that somebody who wants to medically transition should not have to see a therapist, that that's blocking them unnecessarily from getting the kind of medical treatment that they want. Trans activists want people, and even children, to be able to get medical treatment to transition without having to seek mental health treatment. So even children as young as 8 years old now are getting cross-gender hormones, not just puberty blockers, but cross-gender hormones. And one of the places that now has accepted this idea that gatekeeping is a horrible thing is Planned Parenthood. So now anybody who decides that they are cross-gender and wants to medically transition can go to Planned Parenthood and get cross-gender hormones without having any mental health services provided at all. This is an attempt to suggest that being transgender is normal and that the appropriate care is to medically transition, when in fact we know that the vast majority of people who have gender dysphoria, it isn't because they're innately transgender, it's because they have an underlying issue that's causing them to feel dysphoric feelings. And the gatekeeping leads us to another claim that transgender advocates say all the time, and that is that they are being denied medical services and that they're being discriminated against. Typically, patients do not dictate the kind of medical care they get. Typically, patients go to a doctor and the doctor is the one to prescribe them medical care and treatments. In the case of the transgender movement is saying that if a doctor does not provide a trans person with the exact medical treatment that trans person wants, they're being discriminated against and denied medical treatment. And this is a complete manipulation of language. This is not discrimination, and this is not denial of medical services. Even if a doctor said, I think you should get a little bit of therapy before we prescribe cross-gender hormones, trans activists would suggest that that's being discriminatory and that that person is being denied medical services. Another thing that transgender activists use to manipulate people is suicide. They say that children who are not allowed to transition will kill themselves. First of all, there's no data to back that up. That's a completely bogus claim. Second of all, they're talking about suicidality. And there's something that is it's difficult to talk about because these are difficult issues. But there's a big difference between someone who has attempted suicide to get attention or for some other reason versus someone who's actually committed suicide. If you talk to people who have attempted suicide or had suicidal thoughts and self-reported them, those rates are going to be different depending on the population. There are certain populations that are going to be more comfortable reporting the fact that they've been suicidal. There are going to be certain populations that are more likely to do things that are sort of calls for help or cries for attention that would fall under an umbrella of suicidal behavior but really aren't. So I think using suicide as a justification that children need to be medically transitioned is incredibly manipulative. The idea of telling people that children need to be transitioned or else they'll be suicidal is bogus. And I really want to push back on this because this is the justification that they're using to do all kinds of interventions in schools, to teach children about being transgender, to preach for tolerance. And the fact is that suicidal people are more likely to be suicidal. It doesn't have anything to do with gender identity. It has to do with mental health. Suicidality is a mental health issue, not an issue of gender identity. And so people who are more likely to be suicidal are people who need mental health services, not who need to be medically transitioned. And I even hear people say that the reason the rates are so high is because trans people are treated badly. And there are lots of people who are treated badly and lots of categories that are treated badly, much worse than trans people. And yet they don't have the high rates of suicidality. So claiming that the suicidality is due to prejudice and due to not transitioning is bogus. Innate is another word I hear. A lot of trans activists say that gender identity is innate. It's something that you're born with, and therefore it's not changeable. And therefore, we need to be tolerant of people who are transgender, and we need to allow them to transition because their gender identity is innate. And this is not true. And we know this is not true because of people like me who had gender dysphoria as a child, who presented as a boy for a number of years, and who became comfortable in my gender. I desisted. I desisted with my transgender feelings, with my feelings of gender dysphoria. And I'm not the only one. There are a growing number of people who transitioned who have detransitioned because they realized that they weren't the other gender, that gender isn't innate, that gender is a perception and a feeling, not something that is innate. The other reason we know this is because of trans themselves, because rapid onset gender dysphoria, which is when somebody who has never shown any identification with being the other gender suddenly becomes the other gender, suddenly develops gender dysphoria. This wouldn't happen if gender was innate. So gender is not innate. Gender is something that's learned over time and something that's perceived, much like political identity and religious identity. These things are pretty solid, but they do change. And so suggesting that somebody is born with a gender identity is really quite absurd because gender identity is developed and it's based on cultural stereotypes and sexual sex roles and all kinds of things having to do with the way we interact with the environment. They're not innate. All right? Woman. Something as basic as the word woman is now up for grabs because trans activists say that a transgender man who believes he's a woman is a woman. So now we're not even going to respect basic biology and science. And transgender activists will use all kinds of interesting studies to try and justify the statement that a biological male who believes he's female is a female. And this one's pretty easy to spot because there's no other situation that I can think of where somebody insists that they identify as one thing even though they're not, and society goes along with it. Okay, this is just it's one of the most bizarre phenomenons I've ever seen, to see smart people say a trans woman is a woman. We all know that a trans woman is not a woman. A trans woman is a male who believes he's a female or is identifying with a female or who has decided that it's in his best interest to identify as a female. But they're not women. Cis. The word cis is used to describe someone who is who basically has their gender identity aligning with their biological sex. And this word is really quite problematic because someone like me who was born female, who had gender dysphoria and presented as a male for a number of years, and then had the gender dysphoria resolve and now presents as female, is not really cis because I have that gender dysphoria, and I still sometimes have a bit of gender dysphoria when I feel like, gosh, I'm so different from most women I know. This does not make me a trans person, and it also does not make me cis. In addition, cis has become almost a derogatory term because transgender people have decided that being transgender is so brave and heroic that they're somehow better than lowly cis people who happen to be lucky enough to identify as the sex they were born. This kind of language is a really good way of sort of creating a hierarchy of victimhood, and it's not something I'm willing to do. So I am unwilling to use the word cis when I describe people. I think we can talk about men and women, we can talk about trans men and trans women, but I'm not willing to talk about cis men and cis women because I feel like that is, first of all, it's labeling something that doesn't need to be labeled and allows us to further promulgate the idea that a trans woman is a woman. So we have to somehow differentiate between a woman, which is a trans woman, and a biological woman, because now we're somehow saying that there are distinctions between real women and real women, because one type of real woman is a trans woman and one type of real woman is a biological woman. So we have to talk about the biological woman and somehow designate her as different from the trans woman who is a woman. it gets very complicated, and it's a real manipulation of language in order to forward the agenda that that a cis woman and a trans woman are somehow equivalent, even though we have to use these identifiers to designate which type of woman we're talking about. It's really an obfuscation of language. Transgender activists talk about violence, and they talk about violence against trans, and I have no doubt that there is violence against trans people, and that they do get picked on occasionally. Pretty much everybody does, but I suspect that they might be more because they're in riskier positions. A lot of the violence against transgender people and a lot of the murders of transgender people are because they're in sex work. And based on my experience in dealing with trans people who are sex workers, they enjoy the sex work, which is very different from most people who are coerced into sex work. The murder rates of trans people are higher because they have a higher rate of being engaged in sex work. They also define violence very differently than I've ever defined violence. So if somebody uses the wrong pronouns, that's considered violence. If somebody misgenders somebody, that's considered violence. If somebody uses the name that a person originally had prior to transitioning, that's considered violence. There are all kinds of behaviors that transgender activists are calling violence that most of us don't consider violence. So if you're doing a self-reporting survey on the kinds of violence somebody has had, trans people are much more likely to report violence because their definition of violence is so much broader than the definition most of us have of violence. And if we started to define violence as any time somebody hurt somebody else's feelings, I'm sure that the rates of violence would go up for the entire population. And the final word I want to talk about is TERF. And TERF is a word that trans activists use to describe anybody who doesn't believe that a trans woman is a woman. And TERF it stands for Trans Exclusionary Radical Feminist. And it's very confusing to me that this term TERF is being used against people like me, because I'm not a radical feminist. You don't have to be a radical feminist in order to think that a trans woman isn't a woman. You just have to believe in science and fact and biology and all these things that are very tangible. But they've developed this slur in order to somehow suggest that people who believe in biology and science and fact are transphobic. And I find this amazing that we're to the point where someone who believes that there's a fundamental difference between a biological male who believes he's a woman and a biological woman is considered transphobic. They're trying to suggest that anybody who does not agree with their agenda is a transphobe. And then they say anybody who's transphobic is the same as a Nazi, and anybody who's a Nazi deserves to die. And so what they're doing is they're allowing, they're creating a lot of hatred, and they're encouraging hatred, and they're also encouraging violence against women. Because a lot of the people who they label as TERFs are people like me who are biological women who don't agree that a biological man is the same as a biological woman. And what they're saying is that because I have these beliefs, I'm transphobic. And because I'm transphobic, I'm the same as a Nazi. And because I'm the same as a Nazi, I deserve to die. And they say this, okay? All of these terms are used in a way to manipulate people, to make them feel like the transgender people are victims and that we need to protect them and that we need to accommodate them, that somehow they are so discriminated against and so oppressed that we need to institute laws to protect them. When in fact what we're doing is we're instituting laws that affirm a mentally unhealthy perception of reality and has the potential to really damage a lot of children who have gender dysphoria, who are going to be unable to get appropriate medical care because transgender activists have convinced people that a gender dysphoric child is transgender, and therefore they are the gender and the sex that they identify with and should be treated as such. I finished the video, and as soon as I did, I realized there was one other one that's really important to talk about. And that is the idea that sex is assigned at birth. Sex is not assigned at birth. Sex is recorded, okay? It's not like doctors are sitting there like, what should we assign this child? Should we assign it as a boy or a girl? That's not what happens. The doctors who are smart look at the baby and say, this is a boy or this is a girl. There are very rare cases where a child is intersex, which means their genitalia is ambiguous, and it's difficult for the doctors to determine what sex they are. And in that case, usually there are tests that are done to determine the sex of the child. Even in that case, the sex is not assigned, okay? It's recorded. If people accept the idea that doctors are assigning a sex rather than recording it, they're trying to suggest that biology is meaningless and that something as fundamental as whether someone is a boy or a girl, male or female, is subject to interpretation. That's just ridiculous. It's not. That would be like suggesting that the doctors, in addition to assigning sex, they assign a time of birth, or they assign a human. You know, do doctors assign a child that they're human, or is the child born human? Well, most of us would say the child's born human. The doctors don't assign us our species. It's recorded. They don't assign a time. The time is recorded. They don't assign a sex. The sex of the baby is recorded. And that is, to me, the fact that even mainstream media now talks about assigned at birth, the sex assigned at birth, rather than the sex recorded at birth, shows how insidious the transgender movement is. The fact that they've been able to get most of society to accept the term assigned at birth. It's not assigned, it's recorded. Sex is recorded.